Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, lymphadenectomy in carcinoma esophagus. So, if you see the lymphadenectomy in carcinoma esophagus, we have three types of lymphadenectomy which can be done for carcinoma esophagus. So, in the lymphadenectomy, we can do it in three ways. One, we can do a one field lymphadenectomy. So, in one field lymphadenectomy, we will remove the intra-abdominal lymph nodes which are draining the stomach and the esophagus. Proximal stomach and distal esophagus, that is, those lymph nodes which are actually draining the proximal stomach and distal esophagus. This is distal esophagus and proximal stomach. These are removed in one field lymphadenectomy. Then we have two field lymphadenectomy. In two field lymphadenectomy, we will actually remove the intra-abdominal nodes also. We will remove the intra-abdominal nodes and we will also remove the intrathoracic nodes also in two field lymphadenectomy. That is, this is intra-abdominal is one field and intrathoracic is two field. So this is two field lymphadenectomy where you remove lymph nodes from intra-abdominal and intrathoracic nodes. Then we have three field lymphadenectomy. In three field lymphadenectomy, you will remove intra-abdominal, you will remove intrathoracic, and you will also remove cervical. So this removal of three types of lymph nodes from intra-abdominal, intrathoracic, and cervical is called as three field lymphadenectomy in carcinoma esophagus.
thank you and thank you for watching.